So, hello everybody. Good evening. I'm Dr. Nikita, and today's lecture will be about interpretation of flow cytometry. In this lectures, we'll be dealing with different kinds of example and the charts and how do we actually interpret the flow cytometry. So, let's move in. So, what is flow cytometry? I want you to focus on this diagram. So, for flow cytometry is a technique that analyzes physical and antigenic properties of cell using laser-based detection. So, what are the components? First, the fluids. We can see these are the fluids. Okay, again these. Then the next component is optics, where laser beams are used, and the last component is electronics, which helps in detection of the cells. So with the help of this laser cells, one cell is passed at one time, and this laser beam detects them, and it is divided into three parts. First one is forward scattering, second one is side scatter, and third one is fluorescence signals. So what do you see in forward scatter? So forward scatter represents the cell size. Okay, the larger the cell, the higher the forward scatter. So the blasts are larger than the lymphocytes, so FC forward scatter is higher. Okay, now moving on to the second, that is side scatter. The side scatter represents the internal complexity or granularity of the cells. Okay, so neutrophils have most of the granules and are very complex with 2 to 3 nucleus, so they have higher side scatter, and lymphocytes have low side scatter. So what is the use of fluorescent signals? So antibodies tagged with fluorescent dyes bind to a specific CD marker. So that means CD19 tells us about the B cell population, CD3 tells us about T cell population, CD13 and 33 tells you about the myeloid population, and so on. Okay, so in this lesson, chapter, we are only dealing with interpretation and not the flow cytometry as such. For the flow cytometry principle and mechanism of action, we can see that in some other video. Okay, so focusing on the interpretation only. So there are two types of flow cytometry. So first one is histogram and second one is plots. So these are the most commonly used flow cytometry. Okay, so what do you mean by histogram? It shows one marker at a time. So x-axis shows the fluorescent intensity and the y-axis shows the number of cells. So can you see the count? And here it shows the fluorescent intensity. Okay, so on the other hand, dot and plot displays two markers simultaneously. Each dot represents one cell, and dot plot shows cells population as clusters. Can you see it? Okay, so most leukemia diagnosis relies on dot plots. Okay, they are usually divided into four components. So mostly these side scatter dot plots are asked in exams, and we are going to see how do we analyze them. Okay, so moving on in a deeper version. So whenever you get a flow cytometry diagram, the first plot is very important. Most of the times, the first plot shows you about forward scatter and the other one is side scatter. Okay, so sometimes it shows you about forward scatter and CD45. So let's see what is most important and where do we have to focus. So this plot helps in identifying the major blood group population. So we know there are four populations. First, that is lymphocyte, monocyte, granulocytes, and blast cells. So let's see how they appear on the charts. Okay. So see, if you see, this is forward scatter and this is side scatter. Forward scatter tells you about the size. Okay, and side scatter tells you about the granularity. Okay, and complexity of the cells. So can you see this part? This is where RBCs, debris and dead cells are seen. Okay, next chart tells you about next population is of lymphocytes. Why? Because size of the lymphocytes is smaller as compared to the monocytes and granulocytes. Okay, as we further move on to the right, we see the size of the cell increases. That is what monocytes and granulocytes. Okay, and inside scatter we see the complexity. So granulocytes being at the top, it shows these have maximum granularity. Okay, so either forward scatter or side scatter can be used, but sometimes side scatter and CD45 is used. Why? Because this is more sensitive than forwards and side scatter. Okay, and mostly it tells you about the blast population as well. Okay, so CD45 is common leukocyte marker. Okay, so this population is of RBC and debris. Here only the plus point is this is telling you about the blasts. Okay, then moving on, we have lymphocytes, then we have monocytes, and then we have neutrophils. So whenever CD45 is given, we have to check if the blast population is present. Okay, then we have to check leukocyte population followed by monocyte population and then the neutrophil population. Okay, let's go and see how do we actually try to interpret it. So imagine this is x-axis and this is y-axis. So whenever a graph is given to you, you will have to divide it into imaginary 4 quadrants. So this is quadrant 1, this is quadrant 2, quadrant 3 and quadrant 4. So what do you have to do next is, the center of that, you should mark it as 0. Okay, and this axis is again positive x-axis and this axis is again negative x-axis. Okay, whatever is on upper side, this is positive y-axis and this is negative y-axis. Okay, so then try to make it out what quadrant belongs to which one. Okay, so be saying that, I'll write here, this is x positive, y negative, this and this. Okay, what comes in this population? X positive, y positive. What comes in this quadrant? Y is positive, x is negative. Okay, what comes in this quadrant? X is negative, y is also negative. So what did you understand from this? Yes, so this quadrant tells you it is only x positive. Okay, while this quadrant tells you about only y being positive, and this quadrant tells you about both x plus y are positive. Okay, understand? So let's revise it again. This quadrant shows x positive, this quadrant shows y positive, this shows both x plus y being positive, and this shows both are negative. Okay, is it simplified? Let's try to go and check if whatever we have done is right. Did we get both positives? Yes. On this side is x positive, on the upper side is y positive, and both are negative in this quadrant. Okay, in a similar way, when there are multiple population and multiple colors seen, how do we actually identify? So on y-axis, if this quadrant is negative for both, so this this side becomes dim expression for y. Then little higher, as you move higher, the color becomes brighter, so it becomes dim, moderate and bright. So upper side of the y-axis shows the brightest expression for the y. Okay, in similar way, x-axis, as we move on the right, we find the brightest expression on the x on the right side. Okay, then comes the moderate and then the dim. Okay, so let's see how does that look on the diagram. So when you get multiple color diagrams, don't be confused. Why? Because this is showing CD8 population, this is showing CD4. How do we interpret it? This means CD8 is bright, CD8 positive, this is dim positive for CD8. Okay, similar way, this is dim for CD4, and on the higher side this is bright for CD4. Okay, now before going on interpretation, I would like to tell you few key points. Okay, how do we actually approach? Okay, so first one, we always start with CD45 and side scatter. Okay, then second thing what do we do is we gauge the abnormal population. Okay, then we see for if any blasts are present. Okay, then we go and check for lineage. It can be of either myeloid lineage, it can be of B cell type lineage, or it can be of T cell type lineage. Okay, then fifth, what do we see? We see specific marker pattern is present on what. Okay, then we see if there is aberrant any antigen expression. Okay, so we follow this protocol. First we have to see CD45 and side scatter, then we have to see which is the abnormal population. If there is abnormal population, we have to check if the blasts are present. If the blasts are present, then we have to check what lineage it can be. It can be myeloid, B cell or T cell. If no, if yes, then we'll have to check for if any specific marker patterns are there, okay, which are seen in few special diseases, which I'll be discussing further. Or we can see if any aberrant antigen expression is present, which is most commonly seen in different kinds of AML. Okay, so this is the protocol that we actually follow. Now, before going and understanding, diving into the interpretations, I would like to revise in short with the markers that we most commonly use. Okay, so let's study this chart first. Okay, so I hope you learned this markers because I will take lot of revision on this. So most common hematopoietic stem cell marker is CD34 and 117. So mature T cell lymphocyte is CD3, and helper is CD4, and cytotoxic is CD8. Okay, so CD3 is common leukocyte T cell marker. In B lymphocytes it is CD19. Okay, then 20, 22. Okay, but precursor is CD10. Okay, so natural killer cell, you're naturally beautiful when you're of age of 16, and then directly you see at the age of 56. Why? Because to check if you have undergone any procedures at the age of 56, that is botox or fillers or any other thing. So if you're naturally beautiful, you will be at 16 or you will be at 56. Okay, just a thing to remember. Monocytes 14 and 64. How will you remember this? Monocytes. Mono means what? Single. So you're always single on 14th of Feb, and then 64 at the age of 64. Okay, so granulocytes, so 15 and 16. Okay, plasma cells, the most important thing. What is the marker of plasma cells? 38 and 138. Okay, 38, just add 100, so it becomes 138. Okay, then megakaryocytes or platelets, it is CD41 or CD61. Then activated lymphocytes, it is again CD34 or 117. Okay, so most commonly these are the things. So this is the common physiological markers. Now let's see what happens here. Can you remember all of this? No, but I'll give you tricks in between. Okay, so let's read it first and then decide. So AML, what are the markers? CD13, CD33, MO and 117. Okay, and the rest are all pending here and showing you. Okay, so before going to the conditions as such, I would like to discuss the other graph here, then we'll go to the next previous one. Okay, so before checking that, we have to see how many blasts are present and what are the markers for blast. They are CD34, HLA-DR and TDT. Okay, this is the most important slide of this lesson. This is must, you should know. Okay, the common leukocyte antigen is CD45. Okay, T cells, what are the marker of T cells? They are 1 to 8 and 28. So apart from that, which is the head of T cell marker, that is CD3. Okay, then we have B cell. B cell, there are 19, 20, 21, 22, 23. Then double of 20, that is 40, 79A, 79B. Okay, which is the king of B cell marker, that is CD19. Okay, then we have already studied natural killer cell, that is 16 and 56. Okay, then the most important thing, myeloid cell lineage is MPO, then CD13 and CD34. Okay, then monocytic lineage. I have already told you mono means single, you're single on 14 Feb and at the age of 64. Megakaryocytic, mega means big, so 61 and 41. These are the numbers. Okay, so this is the most important slide. Okay, then next we'll go to something called abnormal slides. Okay, so I'll give you a clue here where you will have to know three things. Okay, the first one is CD5 marker, CD23 marker, and CD200. Okay, so these are the cheat codes. This is type 1, and second is CD5, CD10. Okay, so these are the two cheat codes what I'm going to give you. Okay, if you find this pattern or this pattern, that will help you in diagnosing different types of lymphomas. Okay, so moving to the first one, that is SLL, that is chronic leukemia. Okay, then what is that? Lymphocytic leukemia. So we have CD5, CD23, and CD200. Always remember this: CD5, CD23, and CD200. Everything is positive in this. Okay, then comes the mantle cell lymphoma. So mantle cell has only CD45 positive, whereas CD23 and CD200 is negative. Okay, then comes marginal zone lymphoma. Marginal zone lymphoma has everything negative. Okay, everything is negative in marginal cell lymphoma. Okay, then let's go to the erythroid series. Erythroid marker is CD71 or TFRC. Okay, important one is CD71. Okay, then PNH, paroxysmal nocturnal hematuria. Okay, what happens there? CD55 and CD59 is negative. Okay, then there is Glanzmann thrombocythemia. What happened? There is a defect of glycoprotein 2B3A defect. So that is decoded by platelet again, that is CD41 and 61. Okay, then what is the plasma cell marker? Normal one, that is CD45, CD19, CD38, CD138. So multiple myeloma, that is CD45 and CD19 are negative in multiple myeloma, while CD38 and 113 are positive. So the most important slides is this: multiple myeloma, then Glanzmann thrombocythemia, then you should know about PNH, then you should know about marginal, mantle cell, and SSCL. Okay, so I had given you two cheat codes. Okay, first one was CD5, 23, and 200. You will have to remember this. If the markers are from this, then your diagnosis will be CLL, mantle cell, or marginal. Okay, this is one cheat code. Then the second cheat code is this, it is CD5 and CD10. Okay, if you are not given CD23 and CD200 is not given, then you go for CD10 and CD5. Okay, so CD10, let's go. CD5, if it is positive, okay, if it is positive, and then CD23 is also positive in this, then it is SLL. Okay, if CD5 is positive, if CD23 is negative, that becomes mantle cell lymphoma. Okay, very important. Along with this mantle cell lymphoma, what is the most important? That is cyclic D1. Okay, is the most important marker. Okay, now CD5 and CD10. So CD5 is negative and CD10 is positive. So there are two lymphomas here. First one is follicular lymphoma and second one is Burkitt's lymphoma and follicular lymphoma. Okay, but CD10 along with BCL2 positive, that becomes follicular lymphoma, but CDL10 with BCL2 negative, that becomes Burkitt's cell lymphoma. But in Burkitt's there is one more special, which is that it is BCL6. Okay, then moving on to the last one, that is CD5 and CD10. So this is nothing but marginal cell lymphoma, and second one is hairy cell lymphoma. So in hairy cell lymphoma, it is CD5 negative, CD10 negative. Apart from that, in hairy cell leukemia, it is CD5 negative, CD10 negative. Apart from that, it is CD11C and CD103 positive. Okay, so this is the most important thing. So let's revise it again. What do we have to see exactly? So you will have to divide into two population. If there is CD5, CD20 CD23 and CD200 if it is visible in the chart. Okay, if this is visible in the chart, then what all the diagnosis? CLL can be positive, then it can be mantle cell, then it can be marginal cell lymphoma. Okay, so if CD5 is positive, CD23 is positive, CD200 is positive, it becomes CLL. In mantle cell, what happens? Only CD25 is positive, while 23 is negative and 200 is negative. Okay, but what happens in marginal? Everything is negative. Everything is negative. Okay, so this is one slot to identify. Okay, but if this slot is not available and you have been given only with CD5 and CD10, then what do? First of all, what do we have to do is see for CD5 positive. Okay, so CD5, if it is positive, then what are the cells that come here? First one is what? CLL, and second one is what? Yes, mantle cell lymphoma. Okay, so CDL5 is positive. Then along with that, what is positive here? CD23 is positive, but here CD23 is negative. That is how we differentiate. Only when, if you don't have the set of this CD5, CD23 and CD200, then we go for CD10 and CD5. We check for these markers. If CD5 is positive, then you will have to check for CD23 marker is present or absent. If it is present, it becomes chronic. If it is absent, it becomes mantle cell. But in mantle cell, one more important marker can be present, that is cyclic D1. Okay, that is it. Then let's go if CD5 is negative. Then again two scenarios will come. Then we check for CD10. Then we check for CD10 being positive, and then we check for CD10 being negative. If CD10 is positive, what are the two things? First one comes follicular lymphoma. Okay, so it is CD5 negative, CD10 positive. But apart from that, what is it positive for? BCL2 positive. Okay, then second in the row is Burkitt's lymphoma. It is negative for BCL2 is negative, but it is positive for BCL6. BCL6, it is showing it has a relation with Epstein-Barr virus. Okay, so these are the two examples. Okay, moving on with CD10 negative. Then again two examples fall under this category. That is, first one is, yes, that is marginal cell lymphoma. Okay, so these are CD5 negative and CD10 negative. Okay, then second one is hairy cell leukemia. Apart from being CD5 negative and CD10 negative, it also has specific marker, that is CD11C and CD103. These are the most important markers for hairy cell leukemia. Okay, so this is the B cell neoplasm which I have discussed with you and will help you solving most and majority of your flow cytometry charts. Okay, now let's go and see into the first one. Okay, so in the first one, what do we see? First, this is the side scatter. Can you see? Okay, so this is telling you about the side scatter and this is telling you about CD45. So CD45 is common leukocyte marker. Try to find hints if they are given here. Can you see it is written blast? These are 44 in percentage. So that means this is the blast population. Okay, we get it. Okay, then what do we have to check? First we checked CD45 population, then we found the abnormal population. What is the third step? We check if any blasts are present. Okay, then fourth step is we have to check for lineage, and fifth step is we have to check for any specific pattern is there, and the sixth one is aberrant antigen markers which are present. Okay, so first step is done. Second step, we have to check if the blast population is there. Okay, what were the markers for blast? Yes, for blasts the markers were H LADR, second one is CD34, and third one is TDT. Okay, check for that. Okay, so do you find any marker here? Yes, we find HLADR. Now the examiner has already divided you and given you into the quadrants. So this quadrant belongs to what? HLADR being positive and CD34 being positive. What are these markers showing? These are, that means blast population is present. Okay, what is the next step? Then we check for which lineage. Okay, now CD19 and CD45. Okay, if nothing is given, you have to divide it into four quadrants, imaginary. So CD45 is again positive, CD45 and 19 is positive, and there is a population of CD19. So CD19 is positive. CD19 is a marker of B cell. Okay, so blast is present, B cell is marker is present. Then we go for this. CD10 is present and CD34. This quadrant means both are present. Okay. Then again CD10 is also present and CD20. So this marker CD10, 20 and 19 are mostly, and CD13. These are markers of what? These are markers of B cell. Okay, so is there any other lineage like myeloid? No. So then is there any specific pattern marker? No. So I'm finding lot of blast and these are B cells. So what is my answer? My answer is B. So what is my diagnosis? My diagnosis is BLL. So what do you mean by BLL? B type of acute lymphoblastic leukemia. Okay, so this is my interpretation of the first one. Okay, now moving on to the second example, which is this. Again, what is the protocol? Check for the first CD45 and side scatter. Then we get which is the abnormal population. Third step is if finding any blast markers are present. Fourth step is to check for the lineage. If it is myeloid, T cell lineage, B cell lineage. Then we check if there is any specific marker pattern. And then sixth one is aberrant antigen markers, if they are there or no. Okay, so moving on with side scatter and CD45. So what do you see in this? Okay, we see they have already given you, this is the population of blasts. Okay, so here the quadrants are not given, so draw imaginary line. So this is telling CD19 and CD9 is negative. 19 is a marker of B cell, okay, and CD10 is marker of precursor B cell. Okay, now moving on to the next, that is CD5 and CD34. Do not check what is written next because this is per CYP. These are all the dyes. We have just concern with the marker, that is CD, and whatever is written in the initial part. We have nothing to do with whatever is there because this just, it is the name of the fluorescence that has been used. Okay, so if we draw a line imaginary, okay, so what do we see? We see a population of CD5. CD5 is a marker of, yes, it is a T cell marker. Okay, then CD3. Draw imaginary line. Do you see CD7 and CD3 positive? That means again T cell marker. What are T cell markers? Yes, it is 3, 5, 7. Okay, then again here. So what is CD4, 8 and 4? 4 is CD helper cell. CD8 is cytotoxic T cell. Okay, then CD2 and TDT. What is TDT? It is a marker of blasts. Okay, that is precursor cells. Okay, so T cell and blast population. So what is the answer do we get here? We get TALL. That means T cell acute lymphoblastic leukemia. Which type? T cell type. Understood? Okay, moving on to the third one. Sometimes the examiner gives you the diagram and then gives you the peripheral smear. What do you see? We see this blast. Can you see the NC ratio is increased? Nuclear irregularity is seen and there is coarse nuclear chromatin. Okay, so we understand from this, these are blasts which are present. Now let's correlate it with a flow cytometry. So SCC and CD45. This population is of blasts. Okay, so SCC and CD34. CD34 tells you about the blasts which are present. So blast being present. Cyclic D3 and CD34. So what does this population tell you? Yes, cyclic D3 is nothing but cell cycle regulator. Okay, so if we divide it like this, so that means both are coming positive. That means CD34 is also positive and cyclic D1 is also positive. And then the most important thing, if we divide, what is this CD45? The blasts present, and CD7, it is a marker of T cell. Then again T cell along with blasts. So what is this? It is nothing but again T ALL. Why? Because blasts are present and T cell is present. So what is that? T acute lymphocytic leukemia. Understood? Okay. Moving on to the fourth example, which is this. Okay. So this is telling you side scatter and this is telling you about the forward scatter. And they have told you on which population you should be focusing, that is RR2. And here we have 45, CD45, that is leukocyte marker, which is this. Okay, then something comes as MPO and then CD34. And MPO and CD44 being in the this quadrant, both are positive. Few cells are positive for MPO, but few are present for CD. So basically, MPO and CD4. What are these markers? MPO is, yes, myeloid marker, and CD34 is, yes, it is a marker of blasts. Okay, then again HLA, DR and CD33. Yes, CD33 is again myeloid marker and HLA is of blasts. Okay, then CD17, it is absent. CD34 is present. CD34 is marker of blasts. Okay, then CD33 and CD13. So this is the marker of myeloid series and both of them are positive here. Okay, so what all is positive here? CD34 is positive, then CD13, then 33 is positive, then HLA is also positive. So CD13 is again myeloid. So two populations, that is myeloid with blast. So it tells you it is AML, acute myeloid lymphoma. Understood? Okay. Moving on to the next, that is fifth example, which is this. Okay, so it tells you about the site scatter and it tells you about the CD45. So can you see this population dim bright? Okay, we are not able to focus clearly, that's okay. Then we see CD34. Do you see CD34 positivity here? Little. Yes, CD34 is a marker of blasts, so that means blasts are present. Okay, then you see CD13 and 33 and then CD19. If you divide it, what is coming? Yes, majority of the population is here. That means CD13 and 33 along with 19 is positive. Both are positive. So CD13 and 33 is a myeloid marker and CDB is, but the population is very less. So it is B cell marker. Okay. Then apart from that, CD56 and CD again 33. CD56 is normally positive in abnormal cells. Okay, so see, this is again myeloid positivity, again CD this and 90. So abnormal population, it is CD56 as natural killer cell population. Okay, so this is a myeloid population with B cell and this is the blasts. So what do we see? And B19 is also present. So can there will be two heroes in any lineage? Like see, like blasts present. Okay, we get it. Then first, second thing, what do we have to look? We look for lineage. Okay, in lineage I am finding myeloid cells. Then I am also finding B cells, B cell marker. Okay, but can these two be present at the same time? Then we go and check for the number of myeloid cell and the B cell. So in this is nothing but it is AML, but it is which type? It is translocation 821. Why? Because this example, translocation 821, has aberrant expression of CD19. So this is the most important flow cytometry where examiner tries to trick you. So this is, if given unwise, if CD19 is nowhere in the picture, this becomes AML clearly. But aberrant expression in AML, that means there is competition for the two kings, and the majority one is myeloid, and with the little number is B cell. So it becomes AML with aberrant expression of CD19. Understood? Okay. Moving on to the next one, that is this. Okay, so CD45 and CDSCC. So dim positivity means this population, it has blasts. This is a population of blasts. That means blasts are present. Then again, this is side scatter and forward scatter. We don't want to go in detail of that when we have been given so much here. CD34 and here is CD45. Majority of the population is here, but some of the population is also here and some of the population is here as well as here. But majority is in CD45. So can I write CD45 bright positive? Yes, but CD44, the population is less as compared to here and here. So can I write CD34 dim positive? Yes. Okay, then CD34 and CD33. Again, CD33, majority of the population is here, which is telling you that CD33 is positive, which is this. Okay, then we write CD33 is positive, which is this. CD45 is a marker of common leukocyte antigen. Then CD34 is, this is again myeloid population. Okay, then CD again 33 and 117. So 117 and CD33 again is positive. So we write CD33 again is a myeloid marker. Okay, and here CD717 is again positive. HLA-DR is not that much positive. Okay, but yes, then CD34 is positive, dim positive, but cytochrome MP myeloperoxidase is brightly positive. So can we write MPO as bright positive? Yes, and CD34 as dim positive? Yes. But the most important thing is CD38. HLA DR is negative. Okay. So when we compare these charts, okay, so what do I see here mostly? Mostly my focus is on CD34 being dim and HLA being negative. Okay, but CD17 being positive. Okay, so what does this tell you? Yes, CD33 is myeloid positive. That means it belongs to a myeloid area. Okay, then if it is myeloid, is there a blast? No, because HLA is negative, but CD34 is dim positive. So dim positive, does that justify to be a positive? Yes, it is positive, but the positivity is very less. But the most important clue what they have given is CD117 positive. So what is this? This is nothing but very unique example of APML. What is APML? It is acute promyelocytic leukemia. So it has CD34, HLA-DR is negative in this, and CD33, CD103 and CD117, these are all positive in this. Okay, so most important, CD7117 is positive and HLA34 are negative or dim positive, but HLA-DR is negative. So the most important example, it is of APML, acute promyelocytic leukemia. Okay, moving on to the next example. Here you have been given with this cells which are abnormal. I cannot directly see what kind of cells these are. So let's see in the flow cytometry. Can we just know what is this cell? So side scatter and CD45. What are these? These are the blasts. Okay, so then there is CD5 and CD19. CD19 is B cell marker. CD5 is again T cell marker. Okay, then everything is positive, positive, positive. Then CD23 and CD 20. CD, if you divide it into this, that means CD23 is positive as well as CD20 being positive. What are these examples? They are of B cell markers. And what do you mean by kappa and lambda? Kappa and lambda are nothing but they tell you about B cell clonality. Okay, so the ratio between kappa and lambda is 2 is to 1. What does this exactly tells you? This means there is polyclonal population of B cells. Can you see both kind of population? Like most of the population is lambda and most of it is in lambda. So it is equally divided. That means two populations of, that means polyclonal B cell population is present. Okay. So that, what does that tell you? If only one cluster is restricted towards the one side, that means it gives you the hint that something abnormal is happening. But in this B cell, along with CD5 and CD19. So, what is this interpretation? Yes, CD5, CD19 along with CD23. This is the most important for CLL, chronic leukemia, lymphocytic leukemia. So, CD5, CD19, T cell, B cell, and CD23. If it is present, it is CLL or SLL. Most important example. Okay. Now moving on to the next one, eighth one. Okay, here. CD23, CD45. Okay, CD23, CD45. Then CD, what is CD23 and CD5? So do you remember I had given you a cheat code? What was the cheat code? CD5, CD23 and CD200. This is cheat code 1. Then other cheat code was CD5 and CD10 cheat code. Okay. Now in this example, let's dive in and see if we are going to get CD23, okay, present. CD5, okay. So what is this? CD5 is present. So I write CD5 present. CD25 is negative. Then I go to CD10. Is it positive? No. What is positive? CD20 is positive. Can you see a lot of cells here in this area? So what does this mean? This is again 20 is B cell marker. Okay. Then moving on to 200. CD200 is negative? Yes, it is negative. Only few cells are positive, but majority are CD5 positive. So CD5 again positive, CD200 negative. 23 is not given, so just leave it. But if 22, if 20 is positive, what do you think this is? Yes, this is what we have already studied. When CD5, 23 and 200 is positive, it becomes CLL. But if only CD5 is positive and CD23 is negative and CD200 is negative, this becomes mantle cell lymphoma. Okay, and if CD5 is negative, 23 is negative and 200 is negative, this becomes marginal cell lymphoma. Understood? So this is the cheat code 1. So what is the answer for this? Yes, this is mantle cell lymphoma. Understood? Most important example. Okay, now let's go to the next one. Ninth one. Okay, then see, SCC side scatter, then CD45. What are these? Blasts. So then blasts are present. Okay, then we see CD10 and CD19. Divide with the imaginary line. What do you see? Yes, so majority of population is positive for CD19 and CD10. So CD19 is B cell marker, CD10 is precursor B cell marker. Okay, yes, then we divide again here. What do we see? CD19 and CD20 positivity. Okay, then both are positive. So this is again B cell positive, this is again B cell lineage. But here what is something called as BCL2? Okay, so BCL2. So what do you mean? So now we come back to the cheat code. Is there 5 written anywhere? Yes. CD5 is negative. If you draw a line like this, it is BCL2 positive. BCL2 positive and CD5 negative. So what is the answer? What? Now I have already told you this cheat code, which is here. If CD positive, then we check for CD23. CD23 is positive, then it becomes SLL. If CD23 is negative, it becomes mantle cell lymphoma. Okay, now in our exam, in this chart, it was CD5 negative as well as CD10 positive. So that means if CD10 is positive, it can be either follicular lymphoma or it can be Burkitt's lymphoma. But here BCL2 is positive in follicular while BCL2 is negative in Burkitt's lymphoma. Understood? But instead of BCL2, what is positive? BCL6 is positive. Okay, then when both CD5 and CD10 both are negative, then it becomes marginal zone lymphoma or it can be hairy cell leukemia. But in hairy cell, along with CD5 negative, CD10 negative, you should also have CD103 positive and CD11A C positive. Okay, this is the most important thing. Okay, so here CD5 is negative, CD10 is positive, but BCL2 being positive, then what is the answer? Yes, yes, BCL2 is positive. So let me write BCL2 positive, CD5 is negative, CD10 is positive. BCL2 means it becomes follicular zone lymphoma. Okay, this is the answer for this. Okay, moving on to the next one, which is this. There is side scatter and forward scatter. Okay, and then this is CD33, CD3. This is T cell marker, and this is again B cell marker, CD19. So if I divided the population, it is 19. That is B cell positive. Okay, then again I divide it here. So this population is positive for CD10 as well as CD20. Okay, so when CD10 20 is positive here. Okay, then BCL6 is positive and then CD20 is also positive. If I divide it like this, that means both are positive. So what does that mean? Is there anything given about CD5? No. Then is it given something about CD10? Yes. What it is? It is showing positivity. But along with that, what is showing positivity? CD10. Okay. CD20 is showing. That means, and 19 is also positive. That means it is related to B cell neoplasm. Okay. But a B cell neoplasm with BCL6 positivity, BCL6 positivity along with CD10 is nothing but Burkitt's lymphoma. Understood? That is how we deal with the flow cytometries. Okay, moving on to the next one. That is this. Okay, so what is this? CD23, CD5. CD23, CD5 are positive. Okay, then CD20 is dim positive. Dim positive. CD10 is negative. And then CD200 and CD5 positive. CD200 and CD5 positive. Which category cheat code does this belong to? Yes, I told you two cheat codes, that was CD5, CD23, CD200. This is one cheat code. The other cheat code is CD5, CD10 cheat code. Okay, now this belongs to CD5 is there, yes. CD23 is there. Okay, CD23 is positive and 200 is also positive. So what is this? Yes, so everything is positive. CD23, CD200. When everything is positive, what is the answer? CLL. Okay, this is again the example of CLL or SLL. Understood? Okay. Moving on to the next one. Here you have a periphery image where you are seeing a cell which has hair-like projections. So what is this? Yes, let's see if we are in same way are we thinking of the diagnosis. So this is side scatter, this is for CD45. So this is telling you about the lymph that are 43 percentage, then CD5 and CD19. CD5 is again T cell marker, CD19 is B cell marker. So this population is what they have taken. So when they did CD4 lambda and CD8, so there only the population is restricted to lambda, restricted to lambda. That means something abnormal is happening here. Okay, then let's see what is next. CD20 is again B cell positive. Understood? Okay. Then again here if we divide it, CD113 and CD11C. Okay, CD11, CD103 is positive. Then again if you divide it like this, what is that? CD103 is positive. So only B cell. Are you finding blasts? Is there any marker for blasts here? No. But which is the lineage I'm finding? It is somewhere in B cell. Okay, so some B cell. But the most important marker what they have given is CD11 and CD103. So I've already discussed CD11 and CD103 is mostly seen in hairy cell leukemia. From the peripheral smear only we can understand this is a hairy cell leukemia. But this is the flow cytometry diagram, how you actually remember it. So CD11 and CD103 is the most important marker for hairy cell leukemia. Okay, it comes under B cell neoplasm. Moving on to the next one, next example, that is this. Okay, so what do we see in this example? What is this? CD38 positive. If we divide it, CD38 is positive, CD45 is little also positive. So CD38 is brightly positive. Majority of cells are in this quadrant. Majority. Okay, and in this CD, only few cells are there. Okay, so can I write dim CD45 positive in this? Okay, got it. Then again I divide it into 4 quadrants. Then again CD19. CD19 is B cell marker. CD38 is plasma cell marker. Okay, and then it is absent. And then what is CD56 is again natural killer cell marker. Okay, yes. So CD19 is absent. Then lambda and kappa. So it is restricted to kappa. Most of the cells are in kappa. That means they are monoclonal and some abnormal cells. So what is this? Is this NK cell? NK cell, how is it related? So the most important thing is CD45 is negative or dim positive and CD19 is negative. But CD38 is positive. What does that mean? What is a marker of a plasma cell? Plasma cell has CD38 positive, CD138 positive along with CD19 positive and CD45. But in plasma cell myeloma, CD45 and CD19 becomes negative and CD38 is positive. So our answer for this is yes, it is plasma cell myeloma. Okay, why CD45 negative, CD19 negative, CD38 as well as CD138 should be positive for plasma cell myeloma. Understood? Moving on to the next one, that is 14th. Okay, 14th one, CD45 and side scatter. What is this? Not understanding, leave it. Moving on with the next, CD5 and CD19. CD19 is B cell marker, CD5 is T cell marker. Okay, so if you divide, that means they are positive. Then anti-lambda and kappa. So that means the population is restricted only to one population, that is lambda antibody is positive. Next, we divide it again here. What is this? CD20 is positive. And again, if I divide it here, what is the population showing majority? CD38 is positive. Okay, then B cell is also positive here. Okay, then I divide it again. Then CD5 is positive, 81 is also positive. CD5 and 23, again CD5 is also positive. Again CD5 and 23 is positive. CD5, everything is positive. CD200 is negative. This is negative. This is positive. Both are positive. And here CD5 is positive. So what is the thing here? Here, what are the most important things? I have already told you. Check if you're not understanding. So many markers are given. Check for two categories. First one is what? CD5, CD23, 23, or CD200, or CD5, or CD10. So in which category does this marker fit? So in this, am I finding CD5? Yes, CD5 is present here. CD5 is positive here. CD5, CD5, CD5 everywhere. Positive. Then moving to CD23. Do you find CD23 anywhere? Yes. CD23 is here. CD23 is here, which is negative. Okay. Then you check for CD200. CD200, yes, it is here. It is negative. So what is the answer? CD5 positive, CD23 negative, CD200 negative. This is a prime example of, yes, mantle cell lymphoma. Okay, if everything is positive, it becomes CLL. If CD5 is positive, rest everything negative, mantle cell. If everything is negative, it becomes marginal cell lymphoma. Okay, but answer for this is mantle cell lymphoma. Understood? Okay, moving on to the next example, that is this. Okay, so in this we find CD200 and CD20. Only CD20 is positive. CD20 is B cell marker and CD200 is negative. Okay, then again I found CD5 is being positive and CD43 being positive. Okay, then CD22 is positive. This is again B cell marker. CD5 is again T cell marker. In lambda restriction, that means only monoclonality is present. Okay, now does this fit into any category? Yes. What category does it fit? Yes, CD3 or CD5 is positive, then CD23 is negative, CD200 is negative. So, what is the answer? Yes, it is nothing but again mantle cell lymphoma. Got it? That is how we distinguish. Moving on to the next one, that is this. Now, so many markers are given in this. Again, how do we divide here? Okay, so then CD5 and CDSCC. Can you see two populations? Yes. Then again, going to the next one, CD5 and CD19. If I draw a line, yes, positivity is there for 19 as well as CD5. Okay, so 5. Then if we divide it again into the quadrants, so kappa restrictions, that means monoclonality. In this, CD10 is negative, CD20 is also negative. If I divide here, again CD38 is positive. So what all is positive? I am writing it down here. Okay, in this it was CD19 is positive. Then in this second diagram I got CD38 is positive. Okay, and in this is forward and side scatter. Not much to say about. Then kappa and lambda restrictions, yes, if I divide, both are present. Then again this CD38 and CD138. CD138 and 38 is again positive. Then if I divide this like this, CD56 as well as CD19 is positive. So what are these markers telling you? CD19 is marker of B cell and CD38 38 and 138 are plasma cell markers. Okay, so what are the plasma cell markers? 338 and 138 along with CD19 and CD45. Okay, yes. So is anything given about CD45 to call it a normal plasma cell? No. Why? Because in plasma cell myeloma, CD19 should be negative, but here CD19 is positive. So we can't label this as plasma cell myeloma. So is there any other thing that they are trying to give us hint upon? Okay. So CD20, can you see CD20 and CD10 is negative here? Okay. Yes. So, is there anything related to the clue like CD5 and CD10? No, because CD5 mention is nowhere there. But when CD10 is negative as well as CD20 is negative, along with CD19 positivity, 38 positivity, and 18 positivity, this is nothing but diffuse B cell lymphoma. So, what does diffuse B cell lymphoma say? It says mostly that CD19 is positive as well as CD20 should be negative along with CD10 to be negative. If this is there, that means it becomes B cell lymphoma. Okay, that is DLBCL. Okay, but what about CD38 and 138? These are also important markers. So these markers are of plasma cell. So our final answer is diffuse B cell lymphoma with plasmacytic differentiation. Okay. Why? Because along with this, they have positivity for CD38 as well as 138. These are the markers for plasma cells. So the final answer is yes, it is diffuse B cell lymphoma with plasmacytic differentiation. Okay, we have already discussed the LBCL is CD19 positive but CD10 and 20 negative. This is the most important clue for DLBCL and plasma cell differentiation. Why? Because CD38 and 138 are present in this. Okay, then moving on to the next one, that is this. Okay. So site forward scatter peak in this. Nothing given here. So again, what is this CD42? Yes, 42. It is a marker of platelet. Yes. So they have already mentioned here platelet is positive and this is FC is showing you RBCs and platelet. Then CD42 is marker of platelet and CD61 is also a marker of platelet. But here it is absent. CD61 is absent but CD42 is present. Okay. Moving on to this, CD41 and CD61 both are absent. Yes, and this CD61 as well as 42. So, what do you understand from this? Yes, this tells you that it is CD41, CD61 are negative, but CD42 is positive. And what are these markers? CD, 41, 42 and 61 are platelet markers. But one marker of platelet is present, that is 42, but other markers are missing. That means what? There is some abnormality which is happening in platelets. So which is the most common disease that happens? That is nothing but Glanzmann's thrombosthenia. Okay, what is the diagnosis? This is Glanzmann's thrombosthenia. Why? This is CD41. It is a marker of glycoprotein 2B. Okay, and CD61, glycoprotein 3A. So glycoprotein 2B 3A absence is seen in Glanzmann's thrombosthenia. So the answer for this is Glanzmann's thrombosthenia. CD41 present, absent, CD61 absent, only one marker, that is CD42 being present. Okay, moving on to the next one. That is this. 18. Only one simple chart, CD55, CD59. Majority of the population is here, means negative, and few population is here. What are these markers? CD55 absent and CD59 are absent. So that means this is nothing but PNH, paroxysmal nocturnal hemoglobinuria. Okay, so what is happening in this? There is mutation of PICA gene. Okay, so you get blackish dark reddish urine at night. Okay, so remember, this is most important thing. What these are specific markers for PNH. CD55 is absent, CD59 is absent. Okay, moving on to the next one, that is in this lot of markers. Just try to focus. Okay, forward scatter. Okay, divide it. You're not understanding anything. CD45 is present, CD38 is present, common leukocyte antigen. Then CD38 is plasma. Okay, okay, then here again divide. CD36, do you know what is CD36, 34? Nothing. Then just leave it. What you don't know, just leave it and go. If you divide it, both are negative. Okay, no problem. Then CD33 and CD15. Yes, is it positive? Yes. Yes, CD33 is positive, CD15 is also positive. If you divide it, CD17 is positive. CD33 is which marker? Myeloid marker. Okay, CD17 is also a myeloid promyelocytic marker. And then if I divide it again, then HLA, it is a blast which is positive, and CD13 is also positive. CD13 is again myeloid marker. HLA-DR is a marker of blasts. Okay, and CD41 is a marker of platelets. Platelets are also present. Okay, then CD41, it is a marker of platelets. Yes, we have already studied. Then again CD61 is again marker of platelets, which is again positive. Then again CD71, then glycoprotein. Okay, if you don't know anything, skip it. CD1A, I don't know what is CD7 is, again T cell. Okay, so what are the things what I am getting here? First one, is there a blast population? Yes, blast population is there. Which one? That is HLA-DR. Okay, then second we look for lineage. Is there B cell lineage? No. B cell CD19, is it present anywhere? No. Is there T cell lineage? Yes, only in CD7. But main marker is CD3, it is not there. Then we go for myeloid. Is there myeloid marker? Yes. What is the myeloid? It is lineage, myeloid lineage. Yes. What is the marker? CD13 plus CD33, both are positive. Okay, so then what is the answer? But apart from that, I'm also getting CD41 and 61 positive. Okay, so what is this? When blast and myeloid is present, I write it as AML. But if I'm finding 41 and 61, these are megakaryotype markers. So in AML, which category has megakaryocytes? Yes, it is nothing but M7. So what is the final answer? What is AML M7? It is nothing but acute megakaryocytic leukemia. Okay, why? Because blasts are present, myeloid series is present, along with prominently CD41 and 61, which are the markers of megakaryocytes or platelets. So AML M7 category. Okay, that is acute megakaryocytic leukemia. Most important example. Got it? How do we divide it? Yes. Moving on to the next one, that is 20th one. Yes. What is this? CD19 and CD3. CD3 is common T cell, main king marker of T cell. CD19 king marker of B cell. Okay, but these are showing little positivity. It is given here only 6% of CD3 is positive. Okay, but CD1927, do I know anything about that? No. So I just skip it. I'm telling you about exam perspective. Then CD3. So overall the average is only 3. So do you think this is normal? No. An average person has majority of the cells of T cells and B cells. Okay, normal person. But here, can you see T cell and B cell population is decrease. So what is that? It is a immunodeficiency. So when the population of T and B cell is decreased, what is that symptom called? When both lymphocytes are decreased, that is nothing but SC. Okay, immunodeficiency syndrome. Okay, understood? Yes. Moving on to the next one, that is this 21. Yes. So what do you see? Side scatter and Wesley's 45. Okay, but nothing major is we are able to see. Here they have clearly given you CD19 is absent. Absent B cells. It is a marker of B cell, and CD3 is a marker of pan T cell marker. Okay, so only T cells are present but B cells are absent. So what is this condition where only T cells are present but B cells are absent? Yes, it is nothing but X-linked A gamma globinemia. X-linked A gamma globinemia. Understood? It is a immunodeficiency syndrome. Okay, I'm just explaining you the charts. The theory part you will have and be discussed in the next subsequent chapters. Okay, now moving on to the last diagram. This is this. Okay, what is this annexin and what is this PI? Have you heard anything about this? No, but everywhere I'm finding annexin and PI, annexin and PI. So what is annexin and PI? PI is nothing but propydium iodine. Propydium iodine. Okay, and annexin. Okay, so when is this used? Yes, these two are the markers we use in studying apoptosis and necrosis. Okay, in a cell. So how do we see that? See, let's give you this example. So we divide divide that into quadrant of 4. Okay, so then this is showing you the late apoptotic cell. Then this is the quadrant telling you about the normal cell. This is telling you about the normal cell. This quadrant tells you about the early apoptotic cells which are early. This quadrant tells you about the necrotic cells or late apoptotic cells. So where is this used to check in when we give any treatment to the patient of cancer, to check how many tumor cells have been lysed? Okay, can you see here? Here these are live cells. These are early apoptotic cells. These are necrose cells or late apoptotic cells. Okay, this is the control. In 2 hours the number is gradually increasing, then 6 hours, and then 12 hours. In 12 hours we see maximum of these live cells have been decreased and lot of cells have taken necrosis and late apoptosis has happened along with few early apoptosis is there. So this flow cytometry can also be used in knowing early apoptosis, necrosis, as well as studying how the treatment for cancer is taking place. Okay, with this I conclude my lecture and I hope you enjoyed it. And if you have any doubts, please pin it in the comment section. And thank you so much for everything.